Hey, future medical assistants, I'm Danny, and it's time to get exam ready. If you're prepping for the big test and feel a little unsure, don't stress. I've got you covered. We're going to break down real exam style questions, go over the answers, and most importantly, explain why they're right. No guessing, no cramming, just clear, simple explanations to help you feel confident and ready to pass. So go ahead and grab your notes, get comfortable, and let's go ahead and dive in. Question 1. A medical assistant is preparing the autoclave to sterilize instruments. Which item is required to properly process the instruments? A. Sterilization indicators. B. Cotton balls. C. Masking tape. Or D. Purified water. If you said A, sterilization indicators, then you are correct. Now, I do want you guys to remember, we do use water for the autoclave, but it is not purified water. We put distilled water inside of the autoclave machine. Now, the sterilization indicators are essential for verifying that the autoclave has reached the correct temperature, pressure, and time needed to sterilize instruments effectively. These indicators do change color or display other signs to confirm that the sterilization process was successful. This ensures patient safety by reducing the risk of infection from improperly sterilized instruments. Question 2. How many digits are in a primary CPT code? A, 4 digits, B, 5 digits, C, 7 characters, or D, 6 digits. If you said B, 5 digits, then you are correct. The primary CPT codes consist of 5 digits and are used to describe medical, surgical, and diagnostic services. Now, additional modifiers can be used when applicable. They can include alphanumeric characters, but the base code will always be 5 digits. Now, I want you guys to remember those CPT codes are what we call procedural codes. They are based on the procedures that we performed in clinic. Question 3. A first-time patient arrives late to their appointment. What should the medical assistant say first? A. You are late. Please reschedule your appointment. B. We cannot see you today due to your tardiness. C. Please fill out this form before you enter. D. Hello. Welcome to our office. Now, if you said D, hello, welcome to our office, then you are correct. Greeting the patient politely establishes a professional and welcoming environment. Addressing tardiness can be handled later if necessary, but ensuring a positive interaction is first a key to patient satisfaction and continuity of care. Remember, this is a first-time patient. They have never been to your practice before. They are unsure of the rules and the policies that are established. So, first impressions are everything. You want to ensure that you're greeting your patient first. Question 4. Which statement best describes oxycodone? A. Oxycodone is an over-the-counter medication with no abuse potential. B. Oxycodone is a medication primarily used for anxiety treatment. C. Oxycodone is a Schedule II controlled substance with a high potential for abuse. Or D. Oxycodone is a non-narcotic pain reliever used for mild pain. Now, if you said C, oxycodone is a Schedule II controlled substance with a high potential for abuse, then you are correct. Oxycodone, again, is classified as a Schedule II controlled substance due to its high potential for abuse and also dependency. It is a narcotic pain medication that is prescribed for moderate to severe pain. It is not utilized for anxiety or even mild pain, and it's not available over the counter. It can only be obtained through a prescription. Now, with Schedule II controlled substances, I want you guys to remember they do have a high potential for abuse and dependency, but they do have medicinal purposes, which means that they can be obtained through a prescription. When we're talking about Scheduled I controlled substances, they have no medicinal purposes, but they do have a high potential for abuse and or dependency. Those Scheduled 1 controlled substances, we call these like the street drugs. Question 5. A patient begins to faint while a medical assistant is collecting a blood sample. What should the assistant do to ensure patient safety? A. Administer oxygen immediately. B. Give the patient a glass of water. C. Position the patient flat on their back. Or D. Check the patient's pulse and breathing. Now, if you said C, position the patient flat on their back, then you are correct. So positioning the patient flat on their back promotes blood flow to the brain. It reduces the risks of injury or complications. When we position the patient flat on their back, the medical term for this position is called supine. And the way that I always remember this is I say supine is on the spine. Question 6. A medical assistant is caring for a patient with concrete debris on the surface of their sclera. What action should the assistant take? A. Use cotton swabs to remove the debris. B. Irrigate the eye from the inner to the outer canthus. C. Call an ophthalmologist for immediate surgery. Or D. Apply a bandage over the eye immediately. If you said B, to irrigate the eye from the inner to the outer canthus, then you are correct. Irrigating the eye from the inner to the outer canthus is the proper method to safely flush out debris. We would not want to use a cotton swab because this can actually cause more damage to the eye. And I want you guys to remember, when we're talking about the sclera of the eye, this is the white part of the eye. Question 7. Which of the following is considered a bloodborne pathogen? Would it be A, tuberculosis, B, hepatitis B, C, influenza, or D, streptococcus? If you said hepatitis B, then you are correct. Hepatitis B is classified as a bloodborne pathogen because it's transmitted through contact with infected blood or bodily fluids. Tuberculosis and influenza are considered to be airborne diseases, while streptococcus is typically transmitted through direct contact or respiratory droplets. Question 8. What is the primary function of erythrocytes? And remember, erythrocytes are red blood cells. Would this be A, to fight infection, B, to transport oxygen, C, to clot blood, or D, to regulate body temperature? If you said to transport oxygen, B, then you are correct. The main role of those erythrocytes are to transport oxygen from the lungs to our body's tissues. Question 9. Which diagnostic test is commonly used to identify a urinary tract infection? This is also known as a UTI. Is A, a blood test, B, an ECG, C, an X-ray, or D, a urinalysis? If you said D for urinalysis, you are correct. Urinalysis is the primary diagnostic tool for identifying urinary tract infections. It allows healthcare providers to detect abnormalities like white blood cells, bacteria, and other signs of infections. Question 10. What is the main objective of informed consent in the medical procedures? Is it A, to record the patient's medical history, B, to confirm the patient's insurance coverage, C, to ensure the patient understands and agrees to the procedure, or D, to provide legal protection to healthcare providers? If you said C, then you are correct, to ensure the patient understands and agrees to the procedure. Informed consent ensures that the patient is fully informed about the benefits, risks, and also alternatives of a procedure and agrees to it voluntarily. While it does offer some legal protection to providers, the primary goal is ethical and patient-centered, focusing on the patient's understanding and decision-making. Question 11. A medical assistant is reinforcing teaching about insulin injections. Which patient statement demonstrates proper understanding? A, I will store the bottle in the refrigerator before drawing. B, I will roll the bottle between my hands before drawing the medication. C. I will shake the bottle vigorously before use. Or D. I will draw the medication directly from the vial without preparation. If you said B, I will roll the bottle between my hands before drawing the medication, you are absolutely correct. Rolling the insulin vial between the hands helps evenly mix the medication without creating air bubbles. Shaking the vial can cause bubbles that can lead to inaccurate dosing. Now, storing insulin in the refrigerator is absolutely correct, but it is not part of the drawing process. Question 12. Using the RACE acronym for emergency response, what is the first action a medical assistant should take when a garbage can fire starts in the break room? A. Call 911 to report the fire. B. Extinguish the fire with a nearby extinguisher. C. Evacuate staff and patients from the immediate area. Or D. Gather personal belongings before leaving. If you said C, evacuate the staff and patients from the immediate area, you are correct. The RACE acronym stands for R for rescue, A for alarm, C for contain, and E for extinguish. The first priority is going to be to evacuate the staff and the patients to safety before sounding the alarm or attempting to extinguish the fire. Question 13. Which step is performed immediately after a needle stick? Will it be A, wash the area with soap and water, B, cover the wound with a bandage, C, file an incident report, or D, disinfect with alcohol? If you said A, to wash the area with soap and water, then you are again correct. Washing the area with soap and water is the very first step to reduce the risk of infection before reporting the incident or seeking medical care. Question 14. What is the first step when preparing a sterile field? A, put on sterile gloves. B, arrange tools in order of use. C, open the sterile packaging away from you. Or D, sanitize the work surface. The answer is going to be C, to open the sterile package away from you. The answer would not be option D, because remember, for sterile fields, we do not sanitize, we sterilize. Now, when creating a sterile field, the very first step is going to be to open the sterile packaging carefully, ensuring that it is opened away from you to prevent contamination. Maintaining that sterile field is crucial to prevent infections during medical procedures. Question 15. The medical term pyuria refers to what? A, blood in the urine, B, pus in urine, C, excess protein in urine, or D, glucose in urine. If you said B, pus in the urine, then you are correct. Pyuria indicates the presence of pus in the urine. This is often a sign of infection or inflammation in the urinary tract. This condition typically accompanies urinary tract infections, aka UTIs, and it does warrant further investigation. Question 16. Which of the following positions is best for a patient experiencing respiratory distress? A, supine position, B, prone position, C, Fowler's position, or D, Trendelenburg position. Now, if you said C, Fowler's position, then you are correct. Fowler's position is where the patient is seated upright at either a 45 to 90 degree angle. If our patient is positioned at a 45 degree angle, this is what we call semi-Fowler's. If they're positioned at a 90 degree angle, we call this high Fowler's. Having that patient positioned in a Fowler's position promotes better lung expansion, and it's really ideal for patients who are undergoing respiratory distress. The position facilitates breathing by reducing pressure on the patient's diaphragm. Question 17. Which of the following steps should be performed first when assisting with wound care? A, apply the bandage. B, cleanse the wound with antiseptic. C, dry the wound with sterile gauze. Or D, wash your hands and apply gloves. Now, if you said D, to wash your hands and apply gloves, again, you are correct. Hand washing and applying gloves are critical first steps to maintaining asepsis and preventing further infection or any infection during wound care. This ensures a sterile environment for handling open wounds with our patients. Question 18. What type of medication is used to reduce fever? A, analgesic, B, antipyretic, C, antibiotic, or D, antihistamine? Now, if you said B, antipyretic, then you are correct. Antipyretic medications like acetaminophen or ibuprofen are designed to reduce fever by lowering the body's temperature. Question 19. What is the recommended site for an intramuscular injection for infants? Is it going to be A, deltoid, B, gluteus maximus, C, vastus lateralis, or D, brachioradialis? If you said C, vastus lateralis, then you are correct. That one's always a tongue twister for me. Now, the rationale for this is that the vastus lateralis muscle in the thigh is the preferred site for those IM, those intramuscular injections in infants because it's well developed and avoids major nerves and blood vessels. This site is both safe and effective for medication absorption, and that vastus lateralis muscle is the outer thigh muscle. Question 20. Which of the following is an example of an objective sign? A, patient reports feeling dizzy. B, patient complains of pain. C, patient says they feel nauseous. Or D, a measured fever of 101 degrees Fahrenheit. If you said D, a measured fever of 101 degrees Fahrenheit, then you are correct. Now, I want you guys to remember, objective signs are measurable and observable indicators of a patient's condition. Again, an example would be a documented temperature of 101 degrees Fahrenheit, an elevated blood pressure, maybe a positive stress test. Objective signs are those that we can measure. They're measurable and observable. When we're talking about subjective signs, this is what our patient feels. These are those symptoms that we cannot see. They're the symptoms that our patient experiences. Examples would be an upset stomach, a headache, nausea. We cannot measure these directly. Question 21. A provider asked a medical assistant to administer oxygen to a patient who is experiencing respiratory distress. Which of the following actions should the medical assistant take when administering oxygen to the patient? A, attach the oxygen tank to the wall outlet. B, insert the tips of the cannula into the patient's nostrils. C, place the mask over the patient's mouth and nose. Or D, administer oxygen through an intravenous line. If you said B, to insert the tips of the cannula into the patient's nostrils, then you are correct. When administering oxygen, the delivery method depends on the severity of the respiratory distress and also on the provider's orders. A nasal cannula is a non-invasive device that's commonly used for mild to moderate cases, allowing oxygen delivery through the nostrils. It is easy to use and also ensures patient comfort. Question 22. The medical assistant is measuring the circumference of an infant's head. Which of the following actions should the assistant take? A, place the zero marker of the measuring tape against the infant's forehead. B, start measuring from the back of the head instead. C, use a rigid ruler to measure the head circumference. Or D, wrap the tape around the infant's neck for measurement. Now, the correct answer for this is going to be A. You want to place the zero mark of the measuring tape against the infant's forehead. To accurately measure an infant's head circumference, the medical assistant should place the zero mark of a flexible measuring tape against the middle of the infant's forehead, ensuring that it passes around the most prominent part of the head. Now remember, when we're obtaining the circumference of the head, You want to make sure that the tape measure is above the eyebrow and also above the ear. When we're measuring the infant's head circumference, it's a crucial part in their growth process. Abnormally large size heads, or even those that are particularly small, can signify underlying conditions. So we don't want to add to the circumference of their head by including their ears. So again, place that tape measure above the eyebrow and above the ear. Question 23. A medical assistant is reviewing discharge information with a patient who is postoperative following cryosurgery to the cervix. Which of the following statements should the assistant include? A. You should avoid all physical activity for a month after your procedure. B. You may experience a watery discharge for up to 1 week after your procedure. C. You may need to return for another procedure immediately. Or D. You can resume normal activities right after the procedure. If you said B, you may experience a watery discharge for up to 1 week after the procedure, then you are correct. Patients undergoing cryosurgery to the cervix often experience a watery discharge as a normal part of the healing process. It is important to set realistic expectations. So advising against physical activity for an entire month, or even suggesting the need for immediate follow-up procedures, would be an inappropriate unless this is actually instructed by the provider. Question 24. A medical assistant is discussing information with the patient about a new medication the provider prescribed. Which of the following actions should the assistant take? A. Reinforce teaching about frequency of medication administration. B. Advise the patient to take the medication only when they feel symptoms. C. Encourage the patient to skip doses if they forget. Or D. Suggest the patient mix the medication with food for easier intake. If you said A, you are correct. We want to reinforce teaching about frequency of medication administration. Now, proper education about the frequency and timing of medication administration ensures patient compliance and safety. Suggesting that patients skip doses or take medications only when symptoms occur, or even mix them with food without specific instructions from the provider, could actually lead to suboptimal outcomes or even adverse effects. Question 25. A medical assistant is administering an eye ointment to a patient. Which of the following actions should the assistant take? A. Perform a blood draw from the patient. B. Administer an oral medication to the patient. C. Apply a thin ribbon of ointment along the conjunctival sac. Or D. Schedule a follow-up appointment for the patient. If you said C, to apply a thin ribbon of ointment along the conjunctival sac, then you are correct. When administering eye ointment, the medical assistant should pull down the lower eyelid to create a conjunctival sac and then apply a thin ribbon of the ointment. This ensures the medication reaches the appropriate area for absorption. Question 26. A medical assistant is preparing a patient who has psoriasis to be examined by the provider. When inspecting the patient's skin lesions, the assistant should expect to observe which of the following characteristics? A. Brown and flat. B. Yellow and waxy. C. Silver and scaly. Or D. Gray and crusty. If you said C, silvery and scaly, then you are correct. Psoriasis is a chronic skin condition that's characterized by silvery, scaly plaques that are typically found on the scalp, the elbows, and also the knees. Question 27. A medical assistant has a request to collect a routine CBC, complete blood count, from a healthy toddler. Which of the following is the most appropriate collection site? A, the left heel. B, right ring finger. C, right middle finger. Or D, the right arm vein. If you said A, the left heel, then you are correct. For infants under 12 months, the most appropriate site for blood collection is going to be the heel. The puncture should be done on the outer areas of the heel to avoid injury. We never want to stick directly in the middle of the infant's heel. You always want to go laterally, either left or right. Now, finger sticks or arm veins are generally not recommended for infants. When we're utilizing lancets for capillary punctures, the needles inside of them are very small, but think of how small infants are. Those lancets still have the ability to actually break the bones inside of the baby's fingers. So we want to stay away from any finger sticks and make sure that we're doing those sticks on the infant's heel. Question 28. According to OSHA guidelines for universal precautions, which of the following types of patient contact would require the medical assistant to wear gloves, a mask, a face shield, and protective apparel? Would this be A, assisting a provider with the removal of a cyst, B, taking a patient's temperature without gloves, C, conducting a routine checkup on a healthy patient, or D, providing a patient with a prescription refill? If you said A, assisting a provider with the removal of a cyst, you are correct. Any procedure involving exposure to bodily fluids, like the removal of a cyst, does require the use of personal protective equipment. This reduces the risk of infection and transmission. Question 29. A medical assistant is assisting with the examination of an older adult patient who has a curvature of the thoracic spine. Which of the following terms should the assistant use when documenting this finding in the patient's medical record? A, lordosis, B, scoliosis, C, kyphosis, or D, osteoporosis? If you said C, kyphosis, you are correct. Now, kyphosis is a forward curvature of the thoracic spine commonly seen in older adults. This is often due to conditions like osteoporosis. Lordosis refers to an exaggerated inward curvature of the lumbar spine. Scoliosis describes a lateral curvature of the spine. With patients that have scoliosis, you'll see that their spine makes the curvature of a C or even an S. And then osteoporosis is a condition that's caused by the loss of bone density, but this is not specific to spinal curvatures. Question 30. Which of the following types of written correspondence can be signed by a medical assistant? Would this be A, a medical report for insurance purposes, B, prescription for medication, C, referral letter to a specialist, or D, a notification letter to a patient about surgery arrangements? If you said D, a notification letter to a patient about surgery arrangements, then you are correct. Medical assistants can sign correspondence like notification letters regarding surgery arrangements or even appointment reminders, but prescriptions and medical reports do require a provider's signature because they do involve direct medical decisions and also legal implications. Question 31. Which of the following terms describes the body's internal adaptation and change to keep functions in balance? A, metabolism, B, mitochondria, C, homeostasis, or D, osmosis? If you said C, homeostasis, then you are again correct. Now, homeostasis refers to the body's ability to maintain stable internal conditions like temperature, pH, and blood pressure despite any external changes. I want you guys to remember when you're thinking of homeostasis, this is maintaining the balance within the body. Question 32. Which of the following laboratory values is considered critical and must be reported immediately? A, hemoglobin level of 14, B, potassium of 2.5, C, sodium of 140, or D, calcium of 9.5. If you said B, a potassium of 2.5, then you are correct. Normal potassium levels range between 3.5 to about 5.1. A potassium level of 2.5 is critically low and can actually lead to cardiac arrhythmias, muscle weakness, and even life-threatening complications. Immediate reporting and intervention are definitely required. Question 33. A medical assistant is reviewing a patient's cholesterol panel. Which of the following LDL levels is considered high and a risk factor for cardiovascular disease? A, 70, B, 100, C, 130, or D, 190? If you said D, 190, then again, you are correct. Now, the LDL stands for low density lipoprotein. The LDL cholesterol should ideally be less than 100. Levels of 190 or higher are considered to be very high and significantly increase the risk of cardiovascular disease, requiring aggressive management. Question 34. How many seconds does the CDC recommend for the proper hand washing? Is it A, 40 seconds, B, 20 seconds, C, 60 seconds, or D, 30 seconds? If you said B, 20 seconds, then you are correct. The CDC, the Centers for Disease Control and Prevention, recommends washing hands with soap and water for at least 20 seconds to effectively remove germs, bacteria, and viruses. This does include scrubbing all areas, the palms, the back of your hands, and even between your fingers and underneath your nails. Question 35. A medical assistant walks into a patient's room and discovers a fire in the trash can. Which mnemonic device outlines the correct procedure? A, is it NKDA? B, rice, C, pass, or D, race? Now, if you said C, pass, then you are correct. The pass mnemonic specifically describes the correct procedure for using a fire extinguisher. This is a critical step when addressing a small, manageable fire, like one inside of a trash can. Now, the pass mnemonic stands for P, pull the pin, A, for aim the nozzle at the base of the fire, S, for squeeze the handle, and S, for sweep the nozzle from side to side. Question 36. A medical assistant is looking up diagnostic codes. Which part of the diagnostic statement should be used in the alphabetical index? A, the main term, B, the E code, C, the modifying term, or D, the subterm? If you said A, the main term, then you are correct. When looking up diagnostic codes in the alphabetical index, the main term is the primary part of the diagnostic statement that the medical assistant should reference first. The main term typically represents the condition, the disease, or the primary diagnosis and helps locate the appropriate code in the index. Now, the E codes are used to classify external causes of injuries and poisoning, but they are not typically used in the alphabetical index for the primary diagnosis. Now, modifying terms and subterms provide additional specificity or details under the main term, but are not the primary entry point of the index. Modifying terms refine the search after locating the main term. Question 37. Which of the following scenarios is a violation of HIPAA policy? A, reporting workers' compensation data on a patient's employer. B, faxing a patient's demographic information to the pharmacy. C, discussing a patient's diagnosis in a facility hallway. Or D, including the patient's first and last name when reporting a communicable disease to the state health department. If you said C, discussing a patient's diagnosis in a facility hallway, then you are correct. Now, discussing a patient's diagnosis in a facility hallway is definitely a violation of HIPAA. And I want you guys to remember, HIPAA stands for Health Insurance Portability and Accountability Act. This is a violation because it risks unauthorized disclosure of the patient's protected health information in a public area where others can overhear. HIPAA does mandate that patients' information be kept confidential and only shared in a secure and private setting. Now, when it comes to reporting workers' compensation data to a patient's employer, this is generally permitted under HIPAA because it's required by law for workers' compensation cases. Now, faxing a patient's demographic information to a pharmacy is also allowed under HIPAA when it is part of the treatment process. And including the patient's name and reporting a communicable disease to the health department is also permissible, as public health reporting is an exception to HIPAA for the purpose of controlling disease spread. During COVID, maybe some of you guys will remember if you did test positive at the hospital or at your doctor's office, you may have received calls from nurses from the state health department calling to ask you how you were doing, but also to make sure that you guys were quarantining. And the reason they were calling is because it was within HIPAA guidelines for those hospitals and clinics and facilities to share that data with the state health department. Question 38. Which of the following actions should a medical assistant take to ensure chain of custody for a urine drug screen? A. Seal the specimen collection container in front of the patient. B. Send the specimen for processing 36 hours after collection. C. Ensure the patient washes his hands prior to specimen submission. D. Measure the temperature of the specimen within 15 minutes of collection. If you said A, to seal the specimen collection container in front of the patient, then you are correct. Sealing the specimen collection container in front of the patient is an essential step in maintaining the chain of custody for a urine drug screen. This process ensures that the specimen has not been tampered with and that this sample integrity is preserved. The chain of custody process documents each step of the specimen handling, making sure that it is secured from the point of collection all the way through to the lab processing. Question 39. A medical assistant obtains an elevated blood pressure reading from a visibly upset patient. Which of the following actions should the assistant take? A. Perform an orthostatic blood pressure measurement. B. Measure the patient's blood pressure at the wrist. C. Recheck the patient's blood pressure in a few minutes. Or D. Use the palpatory method for the blood pressure. If you said C, to recheck the patient's blood pressure in a few minutes, then you are correct. When a patient is visibly upset, their blood pressure may temporarily elevate due to their emotional stress. By waiting a few minutes and allowing the patient time to calm down, the medical assistant can obtain a more accurate blood pressure reading that does reflect the patient's typical state. This approach helps to avoid false high readings caused by situational factors. Question 40. When performing a distance visual examination, the medical assistant should have the patient stand how far from the vision chart? A, 20 feet, B, 15 feet, C, 25 feet, or D, 20 inches. If you said A, 20 feet, then you are correct. In a standard distant visual examination, such as the Snellen test, the patient is positioned 20 feet away from the vision chart. This distance is standard because the Snellen chart is calibrated to assess visual acuity at 20 feet. This allows for consistent and reliable measurements across patients. Another question that you guys may be asked is it okay for a patient to lean forward when doing the Snellen eye test? The answer to that will be no, because if they do lean forward during the test, it's going to minimize that distance of 20 feet. Question 41. A medical assistant has a patient who presents in clinic with an HMO insurance plan. The provider would like the patient to see a cardiologist. Which form would need to be completed and sent to the cardiologist prior to the patient's appointment? A, an authorization. B, a pre-certification. C, a referral. Or D, verification of eligibility. If you said C, referral, then you are correct. With an HMO, this is also known as Health Maintenance Organization. With an HMO insurance plan, patients typically need a referral from their primary care provider to see a specialist, like a cardiologist. The referral form is necessary because HMO plans require patients to have authorization from their primary care provider before visiting specialists, ensuring that the care is coordinated and also managed within the network. Now, when it comes to authorizations, they may be required by the insurance company for certain treatments, but a referral is the primary step for seeing a specialist. When it comes to pre-certification, this is often related to approval for specific procedures or hospital admissions, not general specialist visits. And then verification of eligibility confirms that the patient's insurance is active, but does not authorize a visit to a specialist. Question 42. A medical assistant is acting as a sterile scrub assistant. Which of the following actions should the medical assistant take? A. Tear the corner when opening the 4x4 package. B. Maintain a 1-inch border around the sterile field. C. Wear non-latex gloves. Or D. Lay the instruments gently on the sterile field. If you said B, to maintain a 1-inch border around the sterile field, you are correct. When acting as a sterile scrub assistant, the medical assistant must maintain that 1-inch border around the sterile field to ensure that the sterile area is not contaminated. The 1-inch border is considered non-sterile, so anything outside of this boundary can be touched without compromising the sterile environment. Question 43. A medical assistant should use which of the following solutions to clean a work surface after a blood spill? A. A 1 to 10 solution of bleach and water. B. A 1 to 5 solution of bleach and water. C. A 1 to 5 solution of hydrogen peroxide in water. Or D. A 1 to 10 solution of hydrogen peroxide in water. If you said A, a 1 to 10 solution of bleach and water, then you are correct. The 1 to 10 bleach and water solution is recommended by the CDC for disinfecting surfaces after blood spills or exposure to bodily fluids, as it is effective in killing bloodborne pathogens like HIV and also hepatitis. This concentration is strong enough to act as a disinfectant while also being manageable for routine cleanings after spills. The ratio will never change. It will always be 1 to 10. If you're utilizing 1 cap of bleach, you're going to use 10 caps of water. If you're using 1 cup of bleach, you're going to use 10 cups of water. The ratio will always be 1 to 10 for the bleach and water. Question number 44. Which of the following cell organelles is responsible for energy production? A, the nucleus. B, the endoplasmic reticulum. C, the mitochondria. Or D, ribosome. If you said C, the mitochondria, then you are correct. The mitochondria is what we call the powerhouse of the cell because this is where the energy of the cell is being produced. Question 45. While setting up a tray for a procedure, the medical assistant notices a coworker reaching across the sterile field. What should the medical assistant do? A, replace the sterile instruments. B, report the incident to the provider. C, cover the tray with a sterile drape. Or D, break down the tray and start over. Now, if you said D, to break down the tray and start over, then you are correct. Reaching across a sterile field can contaminate it, even if no direct contact is made with the sterile items. So to maintain strict sterility and ensure patient safety, the medical assistant needs to break down the tray and reset it up all over again. This has to include new sterile instruments as well as supplies. This will ensure that the sterile field remains uncontaminated. Question 46. Part of a medical assistant's job is to inform the patient about which of the following? A, preoperative and post-op instructions. B, the patient's current diagnosis. C, laboratory result interpretation. Or D, treatment options. Now, If you said A, preoperative and postoperative instructions, then you are correct. Medical assistants are responsible for supporting the provider by reinforcing instructions related to preoperative and postoperative care. They can provide patients with detailed information on how to prepare for a procedure and what to do after, as directed by the provider, ensuring the patient understands these instructions to aid in recovery and also prevent any complications. Question 47. Which of the following is a chronic complication of diabetes mellitus? A, retinopathy, B, renal calculi, C, deafness, or D, acute appendicitis? If you said A, retinopathy, then you are correct. Retinopathy is a chronic complication of diabetes mellitus, specifically diabetic retinopathy, which is caused by damage to the blood vessels in the retina due to prolonged high blood sugar levels. Now, over time, it can actually lead to vision impairment and even blindness if not managed effectively. It is one of several long-term complications of poorly controlled diabetes. Question 48. When completing a fecal occult blood test, a medical assistant is testing for which of the following? A, leukocytes, B, hemorrhoids, C, erythrocytes, or D, diverticulosis? If you said C, erythrocytes, then you are correct. A fecal occult blood test, also known as a FOBT, is used to detect hidden occult blood in the stool, specifically erythrocytes, those red blood cells. Now, the presence of blood in the stool can actually indicate various gastrointestinal conditions like colorectal cancer, polyps, or even gastrointestinal bleeding. Question 49. Proper aseptic technique includes which of the following? A, using an alcohol-based rub in place of hand washing. B, recapping needles before disposal. C, recycling pre-filled syringes. Or D, disposing of used tourniquets in a sharps container. If you said A, using alcohol-based rub in place of hand washing, then you are correct. Proper aseptic technique is essential for preventing infection and contamination. Using an alcohol-based rub is an acceptable practice for hand hygiene, particularly when hands are not visibly soiled, and can be used in place of hand washing to maintain asepsis. However, if your hands are visibly dirty or contaminated, you will need to wash with soap and water. Now, recapping needles before disposal is not a safe practice. You never, ever, 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 ever recap a needle because it will increase the risk of an accidental needle stick. We will always dispose of needles into a sharps container without recapping. Recycling pre-filled syringes is never going to be permitted. Reusing syringes violates aseptic technique, and this can absolutely lead to cross-contamination. And then disposing of used tourniquets in a sharps container is unnecessary. Remember, anything that punctures a patient's skin is considered a sharp. So anything that's disposable that punctures a patient's skin, like a scalpel, a dermablade, a needle, they're going to be disposed of in the sharps container. Now, the tourniquet itself can actually be disposed of in a regular biohazard waste container because it is not considered to be a sharp. All right, you guys, this is the last question of our review. Question 50. After a medical assistant performs venipuncture on a patient, which of the following from the options below is the purpose for inverting evacuated tubes? To distribute serum during centrifugation, for proper mixing of the additive contained in the tube and specimen, to retrieve the liquid portion without cellular contamination of the specimen, or D, for proper separation of sodium heparin? The answer is going to be B, for proper mixing of the additive contained in the tube and the specimen. Inverting an evacuated tube after venipuncture ensures that the additive in the tube mixes thoroughly with the blood specimen. This is essential for accurate test results, as proper mixing prevents clotting in tubes that contain anticoagulants and ensures that any additives are evenly distributed throughout the specimen. That was our 50-question review. You guys did an amazing job. You did it. This was another successful study session in the books. But wait, don't leave just yet. Please make sure that you guys like this video if you find that you've learned something new. Share it with your study buddies. Let's all pass together. Go ahead and subscribe and hit that bell so you never miss a study session. Drop a comment below. What was your biggest takeaway? Let's definitely chat. And I want you guys to remember, study smart, stay confident, and let's get you certified.